Hello, University of Maryland. My name is Zane Adam. I'm a sophomore here, and today we're going to be doing an interview for Nyumburu UNITV with Dr. Joseph Richardson. He's an assistant professor here at University of Maryland for African American Studies, and I'll let him introduce himself.
I'm Joseph Richardson. I'm assistant professor in the Department of African American Studies, and I'm also a faculty associate for the Center for Research, Substance Abuse Research, which is acronym is CSER, at the University of Maryland as well.
And today we're going to be talking about race, crime, and drug policy. So is it alright if we ask you a couple questions?
Sure.
Alright, first question. Can you explain what the Rockefeller drug laws were, and then how did that set the precedent for what we see today in terms of drug policy?
Okay. The Rockefeller drug laws were initiated by the governor of New York in 1973, Nelson Rockefeller. They were actually the first mandatory minimum sentences for drugs started in the country. So it's a prelude to the mandatory minimums we had for crack versus cocaine. So in 1973, New York was being inundated by a significant number of heroin users who were actually committing a lot of property thefts. Some speculate that it could have been a result of so many veterans returning from the Vietnam War, so there was an increase in heroin and cocaine use in New York City. So as a response to that, to appear as if he was tough on crime, Rockefeller created what we now know as the Rockefeller drug laws, where if you had 2 ounces of cocaine or heroin which you were selling, or 4 ounces of cocaine or heroin for possession, you were mandatorily sentenced to 15 years to life in jail. Okay. So at that point in time, New York State prisons in 1973 had 13,000 inmates, and I think roughly maybe 10% of those inmates were convicted for drug felonies. By the year 2000, the prison population exploded to 70,000 in New York State, with 20,000 of those convicted were in for drug felonies.
Okay, next question is, if you could explain to the viewers, for those that don't know, what exactly is the prison industrial complex?
The prison industrial complex is basically the intersection of the state, as we know it, as the public state-run institutions and government intersecting with private industry. So now we have prisons who have been contracted out by the government to provide services and beds for convicted felons. So we have private corporations such as the Correctional Corporation of America, as well as the GEO Group, which was formerly known as Wackenhut, who now operate on the New York Stock Exchange. You can actually buy stock in those prisons, and their product is primarily people. And they claim that they can offer services and beds at a lower rate than the state can, so the state often contracts out these prisons to provide additional beds to incarcerate primarily young Black and Latino men. Since, as I said, in New York, we've seen the explosion of the prison population due to the war on drugs, but right now we have the highest rate of incarceration in the world. 2.6 million people are currently incarcerated. 1.1 million of those are African American. We have an explosion of many more women of color who are going into the prison system as well. So the more that the war on drugs has fed the prison system and has exploded in this hyper-incarceration that primarily has affected Black and Latino communities, those prisons and corporations who are involved in the prison industrial complex have made money off of it. There's a scholar, her name is Michelle Alexander, who has written a phenomenal book called Jim Crow, and is looking at the prison industrial complex as a form of Jim Crowism and an extension of slavery, which we now have in the 21st, our new 21st century form slavery.
All right, and then lastly, to tie this all together, how are black people being disproportionately affected by these laws, and then what do we need to do to make them more just?
Well, in New York State, over 90% of those convicted as drug felons under the Rockefeller laws are black and Latino, which is incredible considering that the population of New York State is totally disproportionate and out of whack with the number of people who have been convicted under drug felony laws. I think only 5% of whites have been convicted as drug felons in New York State. The same is, we see the same kind of parallels in federal sentencing, where 60–70% of those convicted under drug laws have been African American and Latino. I guess one of the ways that we can begin to reduce the number of people who come into the system that are primarily poor people of color would be to reverse some of the laws that we currently have on the books, which recently in 2009 the Rockefeller laws have been reformed, and several of the reforms are that they have restructured people's sentences, so 1,200 sentences are going to be revisited, people who have been sentenced under those laws. They've given judges more discretion, so it's not a mandatory sentencing rule that you have to go to jail if you are caught for having either 2 ounces that you sold or 4 ounces in your possession of heroin or cocaine. So the discretion is now in the hands of the judges to give sentences which they deem are appropriate, where before they were strictly kind of tied into and forced to sentence people under these guidelines. So now they no longer have those kind of restrictions that they have to follow. Also, we've reduced the proportion of ratio of crack versus cocaine. At one time it was 5 grams of crack to every 500 grams of powdered cocaine, but now we have advocated, and I think there's a bill that's going right now through legislation which would reduce it to 1 to 28. But really, if you the reality of that situation is that there was just a recent report regarding cocaine use among people who have been arrested in Washington D.C. recently, and cocaine use is at an all-time low. So it seems really apropos now to reduce the sentencing laws to 1 to 28 when fewer people are now using cocaine, right? So we're not going to flood the prisons with people who are using cocaine. So it almost makes sense now. It seems politically correct to reduce the laws after we've incarcerated generations of people under these draconian laws, where cocaine use is now almost insignificant in the landscape of, at least in the D.C., among people who are arrested and test positive for cocaine.
All right, excellent. Thank you, Dr. Richardson, for your time today. And this is Nyumburu UNITV.